What happens is the brain puts out impulses, goes down the spinal cord, and it comes out through 5 nerves in the neck and the shoulder. Those nerves then mix and match into what we call the brachial plexus. Brachial meaning arm and plexus meaning bird's nest. And all of the nerves that go to the arm and to the chest come out through that area. That area, that brachial plexus area, can be injured for a myriad of reasons, typically trauma or birth trauma, tumors, some other things can cause problems there. And we often repair that area to reanimate or get the arm and chest to move again. There are many different techniques we use to do that. One of the typical techniques that we'll use is something called nerve grafting, where we'll take nerves typically from the patient's leg, sometimes from their arm and sometimes from other areas, and just like an electrician would splice in wires, we splice in nerves to get the arm moving again. Sometimes we'll take nerves from another person, whether it be a living related donor or a cadaver donor, and when we do that, we'll call that nerve transplantation. The center is one of the few institutions that perform transplantation surgery of nerves because it's very, very complicated. It requires a multidisciplinary team of different types of doctors, nurses, social workers, and the like to perform the type of surgery. It's very complex, and there are very few surgeons, frankly, that are trained to do that type of surgery. The basic philosophy of the center is to be all-encompassing for the patient, to take them through the entire process rather than one event or a series of events. It is an entire process, from their initial evaluation to the surgical plan to the follow-through for what frankly may be several surgeries, and then rehab afterwards, splinting, whatever it may be. So it's very complicated as to who may or may not be a good candidate for this surgery. The one thing I can say is that many, many patients are candidates for some type of surgery that would help improve their function. And I think for every patient that's truly a candidate for transplantation surgery, there are many, many, dozens of patients that are not candidates for that surgery, but are candidates for other surgery that can truly improve their function and improve their lives.